Welcome to the Jaros Health Podcast, where we make it easy for you to better serve older adults through our content that informs, community that inspires, and courses that deliver.
Hey guys, Alyssa here for the Old Not Weak segment from Jaros Health, a podcast that helps better serve older adults. So this month, I wanted to chat about a recent campaign that APTA highlighted and had a recent summit about for focusing on immobility in acute care and post-acute care settings. So we all know that prolonged immobility leads to detrimental conditions, pneumonia, deconditioning, skin breakdown, all of those kinds of things. That's not a necessarily new idea. But this campaign that was just rolled out was meant to increase the awareness and start actually giving ideas of program implementation. Because a lot of times we know these things are bad, but we don't necessarily know how to go about changing them, implementing them. You know, if you're just a staff PT, if you're not in a position to change things or to make decisions for the, hospital or larger group. So this campaign was called Everybody Moves. And it was developed by Johns Hopkins, like I said, to raise awareness, focus on reducing the immobility. And what they're trying to do is bring collaboration through different disciplines, so everyone is kind of on the same page of promoting mobility. And so when we think about acute care, the easiest way to prevent a fall is now people are keeping patients in bed. They can only be up with supervision of a nurse or other personnel, using bed alarms, chair alarms, those types of things. And an article that they tagged in this highlight of this campaign was titled Tension Between Promoting Mobility and Preventing Falls, which was quite interesting. Just a short article about basically the over-implementation of measures in the hospital, decreasing mobility, the use of bed alarms, all of those types of things. But it has little efficacy for falls, yet profound contribution to immobility. So they're saying from a 2009 estimate, hospital patients spend over 95% of their time in bed, which leads to a post-hospital syndrome, a transient state of heightened vulnerability following hospitalization associated with increased risk of functional decline, medical adverse effects, and hospital readmission. So again, not necessarily a new idea or a new theory, but we are trying to push for more actual program implementation. So stemming from this campaign, they were able to highlight a couple other ones that have been started overseas that have been very interesting. And I recommend everyone, especially if you're working directly in the acute care setting, to look this up and kind of delve a little bit deeper. They have a ton of resources and things. So, and you may have seen this on Twitter. So the hashtag is #EndPJParalysis. Which started from Brian Dolan, who basically was saying you decrease hospital days or days of hospital stay from, virtually half if you can get rid of this pajama paralysis, meaning when people are in hospital gowns and things like that, it replicates more of a nightgown or a nighttime wear, and they remain in bed, and it can delay recovery because, people feel like they can't move on their own. They just feel like they're not in their own clothes. They're not very motivated to move. So his whole idea was to have patients actually get dressed in their own clothes if there's no actual medical indication, easy access to wounds or anything like that. So to actually bring their own clothes, and then they have a system that they can clear patients with the use of then volunteers to help them move. I mean, clear-wise as mobility. So they can be cleared to be mobile, and then they have volunteers that can come help and motivate them to move and things like that. Like I said, that's a very short synopsis. It also, the NPJ paralysis kind of stems from this, it's called Last 1,000 Days. And so this is actually a whole website. So both of these campaigns are kind of linked together, NPJ paralysis and Last 1,000 Days. Now, the Last 1,000 Days is a very interesting concept. So basically, it's a vehicle for drawing attention to patients' time. So it's widely recognized that, the elderly, chronically ill, those with limiting conditions are the same people who spend most of their time in healthcare settings. So these are the very people who have the least time to waste. So the Last 1,000 Days concept has been developed to help draw attention to where and how time is wasted, to reinforce positioning of patients' time as it is the most important currency in healthcare, and to create basically a sense of urgency that these patients do have a limited life. And so we need to delay the amount of time, they're just sitting in bed, or they're just, not moving around or not engaging socially and those types of things. So, like I said, this website has tons and tons of resources on actual program implementation. Like I said, most of it has been implemented overseas, but it is starting to come over into the States. So basically, we are just trying to, as a profession, draw attention to the importance of early mobility in acute care settings. Again, this is not a new theory or a new concept of the rapid deconditioning in hospital settings with prolonged bed mobility, but now people are starting to realize what types of programs work, how people can implement these things in a large hospital setting where it's hard to kind of get things in motion. With the Last 1,000 Days and the NPJ paralysis, they do a lot with volunteer work. They have trained volunteers that can come in and help with mobility once they're cleared by the appropriate personnel. There is also a program that's called the Hospital Elder Life Program, or HELP, which also is a great resource for actual ideas and things to implement. So there's a lot of information on that program where basically what they do is they have volunteers that go through this semi-rigorous training on proper mobility and things like that. It's very, very basic, and then ultimately they come in and help these patients move around again once they're cleared by personnel. Because we know that as, PTs, we are busy with evaluations and things as people, the caseload keeps growing. So we don't necessarily have extra time to be spending with some of the patients that need these types of resources, need just to move. And it's not as easy for us to kind of have that flexible time, unfortunately. So they're starting to look at other resources, and physical therapists are, again, collaborating on these types of things. They also have the NPJ paralysis in the Last 1,000 Days has a red to green. It's just a way to notify changes in patients' conditions. If they're green, they can get up and move around. If they're red, then they're, on hold, those types of things. So basically, the point of this episode, I just wanted to kind of go through what is kind of coming through the pipeline of the acute care setting. Now, I don't work in the acute care setting right now, but I have had, clinicals and some experience in those settings and know that this is a real thing. I also sat and researched this for a while because you kind of fall into those rabbit holes of, all of these cool things people are doing. And this is a great way, for us in this group to be able to collaborate and think of different ways, or maybe if someone is using one type of program in one hospital, can we, help carry that over to another hospital kind of thing. So we have to use this as a platform. And like I said, the APTA and PT Transforms just recently highlighted the Everybody Moves campaign. And they're all kind of interconnected. The Everybody Moves campaign just recently did a summit that was a 3-day conference for people to join, a global online summit that I was unable to join, but I'm still trying to figure out kind of where access is to the resources and things. But the Johns Hopkins Medicine for the Everybody Moves campaign has resources also stating why bed rest is bad, what can happen, and then offering, did your patient get out of bed today, even if they can't walk far? Did they stand beside the bed or get up on their feet? Did your patient walk around the room today? And there are some mobility measurement tools you can request from Johns Hopkins. So there's a ton of resources out here, maybe to bring up to a supervisor or something, or even just try to implement, just the small things on your own, educating patients about the dangers of prolonged bed mobility or prolonged immobility. And especially the ones that maybe you evaluate and then you don't necessarily have to see again. Even those patients are they need this education too, because if you're in the hospital, maybe you think that you can, you have to lay in bed all day especially if you're not feeling great, but are still able to independently move around. They need to be aware of these things as well. So there's tons of easy to read fact sheets. There's tons of measurement tools or indicators, how to kind of track the movement progress of patients. So I would highly recommend that you check all of these things out. So again, it's the End PJ Paralysis is the hashtag. Last 1,000 Days is a website. And then the Everybody Moves campaign is through the Activity and Mobility Promotion of Johns Hopkins Medicine. So I will put some of those links in the show notes so you can easily go and click and kind of navigate those. But I think it was a good way just to kind of shed light on some of these things and say, okay, we know these facts and we've known these facts for a while. Now, how can we implement these things? So again, I will throw those into the show notes. And if you have any questions, feel free to shoot me a message or contact me in the group. But I appreciate you guys listening here. And I just wanted to go over... Actually, that's it. Okay, so you guys have a wonderful rest of your day. And I'll see you guys next month. Thank you.
Thank you for listening to the Jaros Health Podcast. Go to jaroshealth.com to get the show notes for this episode and find out how you can join the Jaros community for free. You'll get access to our private Facebook group and the weekly Jaros Recap, where we share our favorite reads, podcasts, and any interesting conversations in the Jaros community that week. Once again, that's GEROS health.com. Thanks for listening.